Welcome to another edition of Cincinnati Sessions, a production of the University of Cincinnati Internal Medicine Residency Program. I am your host for today. My name is Jennifer O'Toole, and we're going to be talking about anorexia and weight loss in the elderly. So let's start with our case. We have an 89-year-old female with a history of hypertension, cataracts, and a stroke 5 years ago. She is admitted after a fall at home, for which she sustained a laceration of her head and a right forearm fracture. She's followed by a primary care doc at the hospital-based clinic and lives with her daughter. Her meds include amlodipine and aspirin. Her labs at the time of admission, including a CBC, renal panel, cardiac markers, and urinalysis, are all normal. She's noted to have an albumin of 2.8 on admission. On exam, you find a thin and cachectic elderly female with limited subcutaneous fat. Her exam, including her neuroexam, is otherwise unremarkable. Her fracture is surgically repaired by ortho the day after admission. At that time, the daughter speaks to you because she is concerned about poor oral intake and weight loss over the past year in her mother. On chart review, you note the patient has lost 15 pounds in the past 6 months, and her weight is now down to 100 pounds. So to summarize our case, we have an 89-year-old female with a history of hypertension, a previous stroke, and cataracts who's admitted with a forearm fracture after a fall. She's had 1 year of poor oral intake and weight loss of about 10% of her body weight. And now her daughter is requesting something to stimulate her appetite to help with weight gain. You rule out organic causes of weight loss. So the question is, where do you go from here? How would you manage this patient's anorexia and weight loss? Pause the video now and try to answer this question for yourself. If you are next to someone, present this case to them and discuss together. After you try to answer the question, resume the video. So let's talk about the epidemiology and pathophysiology of failure to thrive and weight loss in the elderly. As you will see from this diagram, the components of failure to thrive in elderly patients are complex and include multiple different factors. The major ones we want to think about are frailty, disability, and impaired neuropsychiatric function. As you will see from frailty, that includes malnutrition and weight loss, and poor physical function. In fact, geriatricians consider frailty as the midpoint between independence in elderly adults and pre-death. The majority of older adults in nursing homes in the U.S. are believed to be frail. They don't all have failure to thrive, but most of them meet the qualifiers of frailty in terms of their nutrition, weight loss, and physical function. And as noted before, frailty is associated with subsequent disability and death, independent of all other comorbidities. So what is the definition of weight loss in the elderly? It is clinically significant weight loss of greater than 5% of their body weight over 6 to 12 months. Studies have found that community-dwelling elderly adults with BMIs less than 25 were found to have greater functional decline and increased mortality. Because of this, many geriatricians now recommend an optimal BMI in the older adult as 24 to 29 kilograms per meter squared. So how would you manage anorexia and weight loss in this elderly patient? What you should be doing is encouraging measures to increase food intake. That includes making sure their dentures fit and they have no source of oral pain. You want to assess for dysphagia and write for an appropriate diet. Assist these patients with feeding in both the inpatient and outpatient setting. Eliminate any unnecessary dietary restrictions. Provide appealing foods that the patients can easily consume. You also want to offer small, frequent meals to these patients. And then lastly, decreasing their pill burden that could impact their desire or ability to eat. What you should be discouraging are measures with limited or no benefit, and that includes caloric supplements and appetite stimulants. Now, I'm sure everybody who's watching this probably at some point has prescribed a caloric supplement or appetite stimulant to their patients, when in fact, there's very little data to support that these are efficacious and actually improve outcomes in our patients. In fact, the American Geriatric Society, as part of their recommendations in the Choosing Wisely campaign, recommend avoid using prescription appetite stimulants or high-calorie supplements for treatment of anorexia or cachexia in older adults. Instead, they recommend optimizing social supports, discontinuing medications that may interfere with eating, providing these patients with appealing food and feeding assistance, and clarifying patient goals and expectations around their intake and weight status. You should also make sure you're thinking about addressing frailty with exercise and vitamin D with these patients. So, applying what we now know to our case, just as a reminder, we are caring for an 89-year-old female with a history of hypertension, a history of a stroke, and cataracts who is admitted with a forearm fracture after a fall. This patient has had 1 year of poor oral intake and weight loss of greater than 10% of her body weight. During the admission, her daughter is requesting something to help stimulate the patient's appetite to help with weight gain. The question you had posed to you was, once you rule out an organic cause of weight loss, where do you go from here? How would you manage this patient's anorexia and weight loss? What we have learned is that we should be encouraging supportive measures to increase oral intake, and we should be avoiding nutritional supplements and appetite stimulants in the elderly population. We should also make sure we're addressing frailty and neurocognitive issues in our elderly patients in both the inpatient and outpatient setting. So, some questions for reflection. What are the components of failure to thrive in the elderly? What is the optimal BMI for a community-dwelling elderly adult? And what recommendations would you make for elderly adults with weight loss? Please pause the video and try to answer these questions alone or with a friend. Try to say the answers out loud. If you have to, rewind the video to find the answers. Thank you for watching this Cincinnati session on anorexia and weight loss in the elderly. I have included some references here, and be sure to check out other videos in this series. Have a great day.